What are the different types of disc injuries?
Well, there are three main types of disc injuries, and oftentimes doctors may interchange these. But in my experience, you have bulging disc, you have herniated disc, and you have ruptured disc. First, a bulging disc is where the disc actually just bulges out of place a little bit. The spinal cord is made up of a series of vertebrae, which are bony structures. You can actually feel them on the back. It's kind of the ridge going down the middle of your back, and then what we call intervertebral disc. Or if you've ever had a jelly donut, it's kind of like that. It's a material that you can actually bend, but in the inside is this jelly-like substance. And what happens in a bulging disc is the donut or the disc actually bulges out of place. If there's a nerve that's nearby and it pokes on it or presses on it, it can cause pain. So that's a bulging disc. A herniated disc is if you think of a big bulging disc where it actually herniates or moves a greater distance away from the vertebral column and presses on nerves. So it's a much more serious injury than a bulging disc. Not that a bulging disc is not serious, it is, but a herniate actually goes further. Some doctors will interchange those two terms and call a bulging a herniated and a herniated the bulging, but in my experience, a herniated is a bigger bulging disc. It's more serious and oftentimes will require surgery. The last type is what's called a ruptured disc. And a ruptured disc is where actually the disc tears or it opens and the jelly-filled substance inside comes out, leaks out, and then starts pressing on nerves, irritating the various nerves, and can cause a lot of problems. Fortunately, for all three types of these injuries, bulging disc, herniated disc, and ruptured disc, there are many, many types of therapies you can have from ESI injections to physical therapy, and lastly, surgery. All three of these have proven successful to help alleviate these problems. Although it's not a 100% success rate, it has been my experience. I've seen a lot of positive results with those types of surgeries.